I'm beginning by scanning the room. Today is March 26, 2022. It is 2:30 p.m. My name is Sallade. I'm an FNP student, and I'm going to begin my head-to-toe assessment by assessing your skin. I'm going to assess the skin of your head and face, your neck, your posterior and anterior chest, and abdomen. I'm inspecting your skin for color, temperature, moisture, texture, edema, bruising, scars, lesions, nevi, and turgor. I'm going to then inspect your head for size, symmetry, and midline position. I'm going to assess your hair for color, texture, and distribution. I'm going to inspect your scalp for any lesions, masses, infestations, and depressions. Do you feel any tenderness?
No.
I'm then going to move on to your temporal arteries. I'm going to palpate. Do you feel any tenderness?
Nope.
I'm going to inspect your lymph nodes, your preauricular, your postauricular, your occipital, your tonsillar, your submandibular, your submental, your anterior cervical, your posterior cervical, and your supraclavicular. I'm going to assess your TMJ by feeling for any tenderness, crepitus, or subluxation. Is this tender?
No.
I'm now going to assess cranial nerve 5, your trigeminal nerve, by assessing the motor aspect by palpating over your masseter muscle as you clench. And then the sensory aspect by having you close your eyes, and I'm going to apply a light touch to your face if you'll tell me where you feel this.
Forehead, cheek, chin, nose.
Great. Next, I'm going to inspect cranial nerve 7, your facial nerve. If you can smile, frown, raise your eyebrows, puff your cheeks, and pucker your lips. Great. I'm going to move on to your ears. I'm going to begin by inspecting the shape and position. I'm going to palpate your tragus and your pinna and on both sides. Do you feel any tenderness?
Nope.
No masses noted. I'm then going to inspect your auditory canal. I'm assessing your tympanic membrane. It is intact and pearly gray. Intact and pearly gray. I'm going to move on to cranial nerve 8, your vestibulocochlear. I'm going to begin with the whisper test. If you could include one ear and repeat after me.
1, 2, 3.
And the other?
ABC.
Great. I'm going to perform the Weber test by checking for lateralization. Do you hear this out of both ears or one?
Both.
Great. And then the Rhine test. Let me know when you can't hear this anymore.
No.
And let me know when you can't hear it.
No.
Great. And again.
No. No.
Great. Air conduction is greater than bone conduction. I'm going to move on to assessing your eyes. I'm inspecting your lashes, your brows, your palpebral fissures. I'm inspecting your sclera. They are white. Your conjunctiva, they are pink. There are no lesions or discharge noted. I'm going to test cranial nerve 2, your optic nerve, by having you read the Snellen chart. I'm going to hold it 6 feet away from you. I'm checking your gross visual acuity. If you could cover one eye and read the line that is clearest to you.
LTFPH.
And the other?
LTFPH.
And both?
LTFPH.
Great. 20/20 vision. I'm now going to test your peripheral. If you could tell me when you see my finger.
No. No.
And both?
No.
Great. I'm now going to test cranial nerve 3, your oculomotor, by testing for direct and consensual pupil reaction to light. If you could just look ahead. Great. I'm going to move on to testing cranial nerves 3, 4, and 6. 4 is your trochlear, 6 is your abducent. If you could look forward and follow my finger without moving your head. Great. I'm now going to move on to assessing for your red reflex and looking in your internal eye structure. Red reflex is present and no internal abnormalities. I'm going to move on to assessing your nose, that it is midline and straight. I'm going to test cranial nerve 1, your olfactory. Please close your eyes and tell me what you smell.
Jasmine.
Great. I'm going to have you occlude one nostril. And please breathe. And then the other. Nostrils patent bilaterally. I'm now going to assess your sinuses, your frontal, and your maxillary. Do you feel any tenderness?
No.
Awesome. I'm going to move on to your throat and tongue. I'm inspecting your lips, your teeth, your gum, your buccal mucosa, your palate, the floor of your mouth, your tongue, your salivary ducts, your posterior pharynx, and grading your tonsils if they're present. If you don't mind opening your mouth, move your tongue side to side, lift it up, and then I'm going to have you stick your tongue out and say, ah. Tonsils are 1+. While I was looking, I assessed cranial nerve 9, your glossopharyngeal, and cranial nerve 10, your vagus, that your soft palate and uvula rose symmetrically with phonation, and cranial nerve 12, your hypoglossal, that your tongue was midline without fasciculations. Next, I'm going to assess your neck, that your trachea is midline without any deviations. I'm going to assess your thyroid gland, if you could swallow. And again, I'm going to palpate your carotid. I am then going to auscultate for any bruits. Okay. I'm now going to move on to your posterior chest. If you don't mind moving to the chair and facing your back to the camera, the couch. I'm going to begin by inspecting for any signs of respiratory distress. I'm assessing for use of accessory muscles, tripod position, and nasal flaring, retractions, tachypnea, and cyanosis. I'm assessing for any obvious deformities and symmetry. I'm going to inspect for symmetrical chest expansion, if you could take a deep breath. And tactile fremitus, if you could say 99.
99, 99, 99, 99.
Awesome. I'm going to percuss over your intercostal spaces. Great. Next, I'm going to auscultate, starting above your scapula. Okay, I'm going to perform egophony, if you don't mind saying E-E-E every time you feel my stethoscope.
E-E-E, 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 E-E-E.
And then bronchophony, if you don't mind saying 99.
99, 99, 99, 99, 99, 99.
And whispered pectriloquy, if you could whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Awesome. I am now going to move on to your anterior chest, if you don't mind moving back to the chair. I'm going to begin by inspecting for any obvious deformities and symmetry. I'm going to again assess for symmetrical chest expansion. If you could take a deep breath. Great. And tactile firmitus, if you could say 99.
99, 99, 99.
Awesome. And I'm going to auscultate. Okay, I'm now going to move on to the heart portion of the exam. I'm going to begin with the aortic, which is the second intercostal space of the right sternal border, the pulmonic, the second intercostal space of the left sternal border, herbs, the third intercostal space of the left sternal border, the tricuspid, the fourth intercostal space of the left sternal border, and the mitral, the fifth intercostal space of the midclavicular line. I'm then going to listen with my belt over the aortic, pulmonic, herbs, tricuspid, and mitral. At this point, I'm going to palpate the PMI at the fifth intercostal space of the midclavicular line. I'm also going to auscultate the apical pulse for 1 full minute, noting the rate and rhythm. Regular and 76. I am now going to have you move to the couch and lie down with the head of the bed at a 30 to 45 degree angle so that I am able to note for JVD and jugular pulsation. I am also going to inspect for any heaves or lifts. I'm then going to feel for any thrills over the aortic, pulmonic, herbs, tricuspid, and mitral. I'm now going to repeat listening with the diaphragm over the aortic, pulmonic, herbs, tricuspid, and mitral, and with my diaphragm over the aortic, pulmonic, herbs, tricuspid, and mitral. While you're lying down, I'm going to assess your abdomen. I'm assessing, if you don't mind sliding up your shirt, I'm assessing for any contours and symmetry. I'm going to begin by auscultating your aorta, your renal arteries, your iliac, and your femoral. No breweries. I'm going to auscultate for your bowel sounds in your right lower, right upper, and left lower. Next, I'm going to percuss. I am assessing for any dullness, tympany, and flatness. I'm then going to palpate for any masses. Do you feel any tenderness?
Nope.
I'm going to palpate for your liver, if you don't mind taking a deep breath. Okay, and then your spleen. Awesome. If you don't mind sitting back up and facing your back to the camera real quick, I'm going to assess for CVA tenderness. Do you feel any tenderness?
No.
Great. I'm going to have you move back to the chair. We're now going to begin our musculoskeletal portion of the assessment. I'm going to begin by inspecting and palpating the joints of your hands, your wrists, your elbows, and your shoulders, noting any redness, swelling, deformities, tenderness, crepitus, nodules, and symmetry. I'm going to assess the cap refill of your fingers, less than 3, and feel your radial pulses. 2+ bilaterally. We're going to begin by doing the range of motion of your fingers. If you can flex, extend, hyperextend, abduct, adduct, and thumb opposition. And then of your wrists, we're going to flex, extend, hyperextend, and then rotation. We're going to do ulnar deviation and radial deviation. We are then going to do our elbows. We're going to do flex, extend, hyperextend. I'm going to go ahead and test the strength of your hands if you can squeeze. 5 out of 5 strength. If you can flex again, I'm going to have you pull in and then push. Flexion, extension of the elbow strength is 5 out of 5. I'm going to have you go ahead and stand up so we can do our shoulders. We're going to flex. We're going to flex, extend, hyperextend. We're going to, if you want to turn, we're going to do internal rotation, and then at the other side, and then we're going to do external rotation above our head and the other side. Okay, we're going to do circumduction. We're going to do abduction and abduction. Okay, I'm going to test the strength of your shoulders. If you could put your arms up like this, and if you could push against my hands, and then if you could pull in. Shoulder strength 5 out of 5. I'm going to go ahead and test cranial nerve 11. The accessory, if you could shrug. Great. I'm now going to test your cerebellar coordination. We're going to do finger to finger opposition. We're going to do hand flip flop. We're going to do finger to nose. If you can follow my finger. Finger to finger. Awesome. I am now going to do, if you want to take a seat, we're going to test stereognosis. If you could close your eyes and tell me what object you feel in your hand.
Pen.
Great. I'm going to test graphesthesia by writing a letter in your hand. If you could tell me what you feel.
O.
Awesome. I'm now going to apply light touch sensation. If you could close your eyes and tell me where you feel this.
Arm. Arm. Leg. Leg.
Awesome. In addition, I'm assessing your upper and lower extremities for skin color, temperature, that your skin is intact, and any edema noted. I'm going to apply vibratory sensation. If you can stick your arms out for me to your ulnar prominence. Can you feel that?
Yep.
Can you feel that?
Yep.
And then your medial malleolus. Can you feel that?
Yes.
And this?
Yes.
Great. I'm going to move on to your deep tendon reflexes. If you could stick your arms out for me. Testing your brachioradialis, your bicep, your tricep, your patellar, your Achilles, and your Babinski, if I could have the bottom of your foot. Great. We are going to move on to assessing your lower extremities. I'm going to assess the joints of your feet or your toes, your ankles, your knees, and your hips. If you don't mind, or I'm going to check your cap refill of your toes. Less than 3 seconds. I'm going to feel your dorsalis pedis pulse. 2+ in normal, and your posterior tibial. 2+ in normal. If you don't mind doing what I do with my fingers, with your toes, we're going to flex, extend, hyperextend. We're going to abduct and adduct. And then we're going to do our ankles. We're going to do them both at the same time for me. We're going to do plantar flexion, dorsiflexion, inversion, eversion, and rotation. Great. I'm going to go ahead and test the strength of your feet. If you could push against my hands and pull up. Awesome. Plantar and dorsiflexion are 5 out of 5. I'm going to go ahead and test your knee strength if you want to pull towards you and then push against. Great. Flexion and extension strength are 5 out of 5. And then your hips, if you can push against and then pull in. Adduction and abduction strength 5 out of 5 for your hips. I'm now going to have you stand up. We're going to do our knee. We're going to do flex, extend, hyperextend, and then we're going to do our other knee. We're going to do flex, extend, hyperextend. We're now going to move on to our hips. We're going to do flex, extend, hyperextend, adduction, abduction, internal rotation, external rotation, circumduction. The other leg, we're going to flex, extend, hyperextend. We're going to do adduction, abduction, internal rotation, external rotation, and circumduction. I'm now going to assess your lumbar spine. If you could turn your back to the camera, please. I'm going to have you flex forward. We're going to note the alignment, feel any tenderness, looking for scoliosis and any curvature, none noted. I'm going to have you extend up, hyperextend back, lateral flex to the side and to your other side, and then we're going to rotation. If you want to turn, great. I'm going to check your cervical spine. You can face the camera again, and we're going to flex, extend, hyperextend, lateral to the left and lateral to the right, and we're going to rotate. Awesome. I'm now going to assess the Romberg. If you can keep your eyes closed, stick your arms out next to you. Awesome. I'm going to have you walk towards the camera to assess your regular gait. Just walk normal. Great. And then walk back to me tandem, heel to toe. Awesome. And I'm going to have you hop on one foot and then hop on the other. Perfect. And that concludes our head to toe assessment.